If you grew up in a house or live in a house built before 1978, you almost certainly are exposed to lead paint. And nobody's going around licking the windowsills, but what happens is as the house settles, it releases lead dust into the environment. So you walk on it, you breathe it in, you eat it, you touch it, you absorb it through your skin.
Are you struggling with bloating, gas, constipation, and fatigue, but don't know what's causing these problems? The Gut Health Reset podcast with Dr. Anne-Marie Barter dives deep into the root causes behind these issues that start in the gut. This podcast will give you the knowledge you need to heal your gut and reset your health.
Thank you so much for joining us here today. It is awesome to have you back for our third and final episode.
Thanks, Anne-Marie. Great to be here.
Awesome. So we are talking now about heavy metals and the gut. So let's just start with, what are heavy metals?
Heavy metals are substances that are not easily able to move around. So the ones that you should be thinking of typically are lead, mercury, cadmium, and then sort of lesser known, but still important are arsenic and potentially thallium, depending on how many organic vegetables you eat from California. So the ones that I really look for, particularly because they're so noisy, they're really noisy issues, is lead and mercury. Cadmium is close behind, but those are the top ones because the lead sits in our bones and can lead to osteoporosis, osteopenia, bone loss, fracture. And then the mercury, because it's both of them are implicated in hair loss and endocrine disruption, microbiome disruption. They're pretty nasty actors. So it's really lead, mercury, cadmium, arsenic, and thallium are the five that we pay attention to.
And how do we get these into our bodies?
Oh, let me count the ways. So right. If you grew up in a house or live in a house built before 1978, you almost certainly are exposed to lead paint. And nobody's going around licking the windowsills, but what happens is as the house settles, it releases lead dust into the environment. So you walk on it, you breathe it in, you eat it, you touch it, you absorb it through your skin. If you do construction on a house built before 1978, you dust the lead and then you again breathe it, absorb it, possibly ingest it. For the mercury, the two major sources, there's others, but the two major sources are fish. Well, I'll say three: fish, fillings, and working to remove gold and ore from the ground. These processing things use actually mercury. So those are the top major sources. If you live near some kind of plant that makes food that uses mercury in the processing, you can get exposed that way. But more commonly, high mercury fish, mahi-mahi, swordfish, tuna, tilefish, and then the silver fillings, which are 50% mercury by design.
Let me ask you one on lead. I read a statistic that said about 60% of women's lipsticks have lead. Is that true?
I don't know if that's true. I would say when you're buying something that originated outside of the country, they do not have the same levels of rigorous testing that we might. So I would be very wary when you're buying something that says, made in China or Vietnam or any poorer country, because especially China is very contaminated. So there's a lot of things that sort of sneak in.
And how do these heavy metals maybe affect our gut for starters? How do they affect our gut, our microbiome?
So all these things are gut microbiome disruptors. So they can make the gut irritable. They can make biofilms that make it difficult to get the gut in balance. They can make it difficult to process things properly. It can really create a state of inflammation and imbalance in the gut, and also again disrupt the microbiome, alter the bacteria, make it very hard to have a good experience in the gut.
Yeah, and what are some symptoms? We think about a lot of times exposure is acute exposure, right? And that's what we think of, and blood testing. I think that there's so much confusion around how to test for maybe more chronic and subacute heavy metal exposure. So, what are some of the misinformation around that?
Sure. So acute exposure to heavy metals, you can actually see sort of like a flu-like experience with nausea, vomiting, diarrhea, abdominal pain. That's much less common because what we're getting is this slow drip of exposure. I had mercury fillings in place, drip, 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 right? A little bit here, a little bit there every time I eat or brush my teeth. If you're eating high mercury, if you eat ahi tuna for sushi, 1 6-ounce serving is more than enough mercury for more than a month, but a lot of people are eating it every week. So the exposures, you can test for acute exposure in the blood, but that's only acute exposure, and that's really only lead and mercury. And that tells you what have you had in the last 4 to 6 weeks that your body has not been able to metabolize. That's like you picked up the mercury thermometer, broke it in your hands, and rubbed it in. That would be an acute exposure. However, because the body knows that it's toxic, what happens is your body sequesters or hides all these metals away in your fat and your bones and your organs so that you don't see it in the bloodstream. So the bloodstream is not a really good way to look for it unless you had a clear acute exposure. So then you transition for this more chronic exposure. Typically, I recommend we look at urine. You're going to need a functional medicine provider to do that. And it's a both baseline and provoked urine test that looks at, just make sure there's no acute exposure. That would show up on a baseline test. And then you provoke with something called DMSA, which binds really well to lead and mercury in particular, as well as some other metals, and allows you to draw it out and start to get a sense of what's actually there, what's present.
So how do we avoid these heavy metals?
Yeah, I mean, it can be pretty difficult. It's kind of subtle, especially for mercury. If you're eating, so some of it's very easy. Don't eat high mercury fish, period. Like just don't eat it. And especially if you're someone who thinks you might have a problem with detoxifying, don't eat it because every exposure makes it even more difficult for you. If you're going to live in a house that's built before 1978, one recommendation is do a lot of washing, like wash down the walls, wash the floors, pay particular attention to the corners, have high grade quality air filters to pull out anything that gets airborne. And if you're going to do construction on a house built before 1978, that would not be the house where I would say don't do it yourself. Pay someone and don't be in the house when you do it. Okay. If you eat a lot of oysters, don't eat the West Coast oysters because they have a lot of cadmium in them. So, and then rice, well, it's sort of counterintuitive because brown rice is better for you because you get the fiber, but white rice, jasmine rice, it has less arsenic. So sort of balance that out, do your best.
I don't know about you when you're running challenged heavy metal tests, but I would say more than not, people have some chronic heavy metal exposure on those tests. And I don't know what you've seen or experienced, but even people that don't think, and they do a good job at avoiding these things are still having some heavy metal exposure. What's your experience been there?
I think that it's only been within the last 10 years-ish that we've really cracked down on no lead in jewelry and no lead in baby toys and no lead. There's the Prop 65 in California that said really clearly, you can't have toxic substances, or you have to let people know what's in their products. But that's within the last 5 years. So people really are let me back up. We came from people who got a lot of exposure. If you were born in the 1920s, 1930s, 40s, 50s, there was a lot less regulation. So our ancestors got exposure. It crosses the placenta. It crosses the breast milk. Breastfeeding is a detox event for you and me, but it's a tox up event for the baby. It's still worth breastfeeding. All in, it's better, but we're all getting exposed simply by having been born to people who had high levels of exposure, because mercury fillings were the way it was. There were no composite fillings until 20, 25 years ago. So a lot of us are getting exposed simply by being born. And then you pile on, now we're testing the tuna fish, the cans of tuna fish, but tuna fish wasn't tested when I was a kid, and it was not necessarily the smaller tuna, it was the bigger tuna. So there's a lot of ways that we've aggregated this over the years. And I do think it's a lot more common. In my practice, it's super common. We do detox all the time because our practice is the people who say, you know what, I believe there's a better way. I believe in being healthy and getting better decade after decade. And so we're looking at how do we peel off risk factors for cancer, diabetes, dementia, insulin resistance, and heart disease. So our patients are a little bit different, but it's super common even in that group. It's really common.
Well, yeah, this has been amazing. Thank you so much for coming here and sharing your knowledge. And where can people find you and find your amazing book if they're interested in looking at that?
Sure. We're on Amazon. Our book is sold on Amazon. If you type in Dirty Girl Trubow or Dirty Girl Detox book, you'll get it. You probably won't get it if you just type in Dirty Girl, but it's right. Everyone gives that like, oh, I didn't think about that. So don't do that. Just add something else. And then we're on Instagram. I'm on Instagram, Wendie Trubow, MD, and that's my handle for Instagram, Twitter, Facebook, and LinkedIn. It's WENDIE TRUBOW, And then we have a free gift for people if they are looking for how do we level up? How do I start to clean up my environment from BPA and plastics and everything, right? Like what's in your Teflon pans. So that's a guide at 5journeys.com/promo, PROMO. And that's a free guide that'll help you get started on walking through it.
Awesome. Well, thank you so much for being here and sharing all of your knowledge.
My pleasure, Anne Marie. Thank you.